Okay, so this is another short video on the actually the importance of phase one positioning and phase two positioning and what those things are for within the mix of what you have to do every day. So much of the discussion around positioning is around the right way or the best way to do positioning, and clearly there is a good way to do this, but actually, like different sects within a religion, there's often little difference in any meaningful sense between the different philosophies. There's a great difference between the practitioners, and that matters, but actually the key is that you think about what positioning is for and when it is done as a result. So positioning is often carried out in phase three, and there's nothing inherently wrong with that. You have to do it in phase three, despite our view being that before phase two is the right time to do positioning. So how do we square that circle? Well, positioning at phase two isn't supposed to be declarative. It's not supposed to result in a statement, but it should, if you're doing it right, result in strategic options, in a clinical development plan, in a draft label. And we've talked before about the importance of the label as opposed to the positioning statement. We'd argue that it's way more fundamental to the success of a product to do positioning in phase two, even if you don't produce a statement, than it is to have that later statement. But clearly both are better than either one alone. Core to the belief is the idea that phase three is when you should be studying your positioning, not just studying your molecule, but studying your positioning. So clearly waiting until you're there can't possibly work well. Studying your phase three while you're doing studying your positioning in phase three means that you have to have done it before you got there. And that's clearly important. So let's say, as it should, that your phase three should include your value demonstration endpoints, and it does have to include those things. Well, you need to have had them in your phase two. And in order to have them in your phase two, well, you need to have thought about it before you get there. So when you're in phase one. So because so many think about positioning the way that some old book told them, or some agency dinosaur about positioning, and there's lots of anxiety about how and when to do it. But actually, what you need to think about is about what we would call stage appropriate positioning. So phase one positioning is important, but it's not the same as phase three positioning, and this is where this starts to pull apart. The point of positioning really changes by phase. Positioning in phase one should, by definition, be about possibilities. When you know so little about the molecule, you need to know so much about the market, which is when really your insights plan should be developed. Which markets, which unmet needs, which kind of headroom is there within those unmet needs, what competitive set, what values placed on that. All of those things about the market should be known before you start asking the molecule whether it can do some of those things. It's also the phase at which you think about proof of concept. Now, proof of concept seems obvious. It's one of those phrases that we use a lot without actually qualifying it very often. But one of our mottos at IDERA is you can't you can't do proof of concept unless you have a concept to prove. Now, by concept, we mean something fundamental, which is what's the idea of your drug. But what we mean is that so many proof of concept studies are really just mini phase threes, dragged back into the smallest possible size to get enough of a signal to go to the phase three that you want to go to. Well, that's fine, except that's not what phase two is for. Phase two's stats aren't really good enough to give you that signal. And that's a problem that many run into. But let's say you'd had in phase two a radar sweep of possible indications, a set of business cases, which you'd established in phase one. So you'd have a range of concepts to explore in phase two. So imagine, for example, that your positioning had developed options for your cognition agent that hinted at, say, increased neuroplasticity or its ability to enhance attention. But you don't know whether that's in combination with Aricept or patients with Alzheimer's or other dementias or schizophrenia or MDD or ADD. You don't know any of that yet. Or whether that same asset could work on something else, stroke, pain. We don't know. It's okay to not know the answers, but what's unacceptable is not to know the questions that you might ask that molecule, the possibilities, the business case options. That's what positioning is in phase one is really to understand the trajectory, the place that you might want to take your molecule, the questions that a market is waiting for you to answer. Now, clearly, as you move into positioning at phase two, that's when it gets serious, when the differentiation is deep and you do it. It's not superficial. It's not telling a story that someone else has already laid down for you. Again, it's not about the statement. It's about the idea of the drug that you're taking into phase three. Phase two, positioning should be about endpoints that matter, patient populations, the segmentation, the value endpoints, the comparators, the label claims, the business case, all of those things. That's when positioning is clinically meaningful. And that's important too, that it means something when you get there. The most important deliverable of positioning at phase two, it's your path to market strategy. How you're going to get from where you are to really to market. Also, clearly, it's an opportunity. It's a framework of reference by which you can answer questions. So, what market shaping, what market development might you need to do? What scientific platform should you do? And a scientific platform comes after you've chosen your positioning. Literally no point in doing the scientific platform first if it's at odds with the positioning. And again, that's something that people get wrong, the wrong way around. We've even seen one company do branding before they do positioning, which just makes no sense at all in the world of pharmaceuticals. So positioning always comes first. It provides that strategic framework against which to decide what you're going to do differently. So, and if the world needs to start thinking differently about a disease, that something different matters, then the competitors are saying, well, this is the phase when you want to know what the tasks are that lie ahead of you. Finding out with 6 months to go that you wish you'd done a different study, well, that's not a recipe for success. Blockbusters are created in phase two. All that happens after that is that you get to launch them. Blockbusters don't get made in phase three. So positioning of phase one is about possibilities. Phase two is about differentiation. So use those phases extremely well because they won't be coming back to you anytime soon. Thank you very much.